Hello, everyone, and welcome to another edition of the Advisory Health Council's Wellness Spotlight. I'm Dr. Ken Friedman, president of the Advisory Health Council. With us today is Dr. Rachel Hoffman, a pediatric dentist with 7 years of experience in East Brunswick. Welcome, Rachel.
Hi, Ken.
So, Rachel, I know that you're a second-generation pediatric dentist. Your father, Dr. Stephen Hoffman, a very well-respected pediatric dentist in East Brunswick, is your dad, and you joined the practice with him. Tell us, what was it like growing up with your dad being a dentist? What was it like, especially on Halloween?
Well, Halloween is pretty normal around our house. We eat candy just like everybody else. But it was interesting being the child of a pediatric dentist in East Brunswick because, you know, all your friends at school knew your dad and thought he was so nice and so wonderful. And it was hard. It was big shoes to fill, that's for sure.
And you had to make sure you brushed your teeth at least 3 times a day.
Absolutely.
Right? You were the one with the pocket protector and the toothbrush in your pocket?
Something like that.
Rachel, what made you become a dentist to follow in your dad's footsteps?
Well, you know, basically just growing up with him as a dentist and seeing what a wonderful profession it was, helping people, helping children specifically. And it's a really good career for women because you can be your own boss and make your own hours and still have a family and a life outside of work. So.
Now, I noticed that your dad is a DDS and you're actually a DMD. Could you explain to everybody what the difference is between the 2 degrees?
Sure. There's absolutely no difference between the 2 degrees. It's just semantics. Originally, DDS was the only degree, Doctor of Dental Surgery, and then Harvard opened a dental school. And they wanted something that was more Latin, and when they translated it, it came out to DMD, which now stands for Doctor of Medical Dentistry. I don't really know the Latin. And then other schools just followed suit. So it's really just a matter of what school you go to, but the curriculum is 100% the same. Everything else is the same.
Now, you specialize in taking care of children.
Yes.
How old are your patients? My
patients are anywhere from typically 1 year to 22 or so. It's hard for them to leave us, which we love, of course. We love having them around. But yes, so typically you start coming when you're about 1 year of age.
And what are some of the distinctions between pediatric dentistry and adult dentistry?
Well, not too many differences as far as the actual dentistry, you know, doing fillings and cleanings goes, but there's a lot more involved in growth and development and understanding what goes on in a child's mouth, which is why there is such a specialty. Just like you have pediatricians for growing bodies, we have pediatric dentists for growing mouths.
Okay, and you said that your patients age and range from about 1 year to 22 years.
Right.
Do you recommend that people bring their child to the dentist for their first visit at 1 year of age, or should it be sooner than that? What do you think?
So the American Academy of Pediatric Dentistry, they recommend that you bring your child 1 year of age or 6 months after the first tooth comes into the mouth, but no later than 1. I feel it's especially important when it's your first child. You really need to have a pediatric dentist that you can communicate with, somewhere to go. The AAPD calls it the dental home, so that if, you know, God forbid, your child falls, there's an accident, an injury, cavities, anything like that, you have someone to call, somewhere to go that you have an established relationship with. Also, when it's your first child, it's obviously important to get all of the pertinent information on how to take care of the teeth and diet and hygiene and all of those necessary things.
Now, you know, when you talk to adults and they think about the kind of dentist that they want to go to, obviously they want to go to somebody who's clinically competent and knows what they're doing. Right. And the second thing that they want is somebody who knocks them out and they don't feel a thing. What are some of the things that parents need to think about before they select a dentist for their child?
Well, the pediatricians are a great resource. They know the pediatric dentists in the area. And can refer you to someone that they have had an established relationship with over the years, that they know and trust their clinical skills and basically the pediatrician is the best resource, I would say.
Now, we all understand the importance of proper digestion as it relates to wellness, and the mouth is really where digestion begins, so it's very important to take good care of your mouth. What are some of the things that parents and children need to know and do in order to be able to have a better level of oral hygiene, besides the typical brushing and flossing and things like that?
Right. So when the first teeth erupt into the mouth, you want to start cleaning them immediately. Some parents don't necessarily know that. You always want to make sure they're free of food debris, plaque, and things like that.
Now, a lot of parents think, well, it's not that important for my kid's teeth because they're going to lose them anyway.
Right.
So what's the point of taking them to the dentist and incurring that expense and putting the child through something that they may not necessarily want to like to do? I know my children who go to you guys absolutely love the experience that they have in your office, but as far as going to doctors go, a lot of people have a lot of trepidation about going to the dentist. So what do you say to parents who say, well, those teeth are disposable anyway, so what difference does it make?
So basically what you want to do is put them on a path of lifetime wellness, good oral health, and wanting to go to the dentist. Like you said, your children actually enjoy it, and most of my patients do really enjoy coming. So that would be, the first thing I would tell any parent. It's not like it was when they were children, and the kids don't have that fear. And you really do want to put them on a lifelong path of good oral health. As far as your question about, their baby teeth are going to fall out anyway, unfortunately, if you do have cavities in the baby teeth, you will obviously incur some sort of pain and infection, and it leads children to not having proper nutrition, not doing well in school because they can't concentrate because they're having mouth pain, not being able to sleep well, and things like that. Also, the baby teeth are there for a reason. More importantly than just for eating and appearance, they are there to hold the place for the permanent teeth later on. So you can have problems as far as growth and development if you prematurely lose those baby teeth.
So then that would presuppose the child to other possible dental problems or orthodontic problems later on in life.
Absolutely, orthodontic problems, yes.
Okay, so it makes good sense to take care of baby teeth to avoid potential problems later on.
Absolutely.
So how often should someone bring their child in for a pediatric dental checkup?
It is recommended that they come in every 6 months. At each visit every 6 months, we do a full exam, cleaning, fluoride treatment, topical fluoride treatment. Sometimes we do x-rays, pictures of the teeth, so we can see the insides of the teeth as well as the outsides. And just monitor, again, the growth and development so we can catch problems early before they become larger problems.
What about fluoride? Let's talk about that. I know there's some controversy over fluoridation. There's some concern that because it's a toxic substance that it may be harmful to the body. What's your position on that? Do you think that water should be fluoridated these days, especially with toothpastes having fluoride and dentists providing fluoridation for their patients? Do you think it's necessary to supplement it in the water system as well?
Well, absolutely. Over the last 20 years, the rate of cavities has gone down 60%, most of which has been attributed to fluoride in the water. That's mainly in major cities, and not every township has fluoride in the water. East Brunswick does have fluoride in the water, so if you are a child living in East Brunswick, you don't need any supplemental fluoride. As far as vitamins go, oral fluoride. There are different kinds of fluoride. The fluoride that you get when you come into the office is a topical fluoride, and what that's going to do, it's going to help strengthen the enamel on the teeth that are in your mouth.
So that's applied directly to the teeth,
It's applied directly
and then
to
the
the
patient
teeth.
sits there and waits for it to
kind of absorb in. Yes. And that helps prevent those teeth that are in your mouth from getting cavities. The fluoride that you get from the fluoridated water or from a fluoride chewable tablet that you take daily, that is more for the enamel that is on your permanent teeth that's forming in the jaws. So as the enamel on the teeth are forming, it is strengthening that enamel. So it's really two different purposes there.
I see. And in addition to fluoridation, what other things do you think our viewers could learn that would help them be able to help their children have a better level of oral health and overall wellness?
Well, obviously most important is hygiene, is brushing. You want to make sure they're doing the brushing 2 times a day. I can't emphasize that enough. It seems like a very simple thing to do, but you'd be surprised how often I hear that that is not taking place in the home.
Is there a toothbrush that you recommend? Is there one over another that's better?
I say whatever toothbrush is going to get your children to brush is the one that they should have.
So the electronic toothbrushes, the sonic toothbrushes, are they just as good as a handheld?
Yeah. Especially for children, I would say they're equally as good. It just, if it's going to make brushing more fun for your kids and make them remember to do it more often because they want to play with their fancy electric toothbrush that sings music to them, then by all means, that's great. It's whatever is going to encourage them to brush. So that's obviously number one. And number two, really very important is diet. In a cavity-prone individual, what you are ingesting, both eating and drinking, really has a great effect on the number of cavities that you'll get over your lifetime.
Can you explain a little bit more about that? What things in the diet should parents look out for, and what things in the diet should parents promote to be able to help children have better oral hygiene and better health?
So for me, the biggest one that I see are sugary drinks. So that would consist of things like juices, all the juices, things like Kool-Aid and Capri Sun in the juice boxes, iced tea, lemonade. In particular, now I'm seeing a big issue with the sports drinks like Gatorade, vitamin water, things like that. They have a tremendous amount of sugar in them. So that is really a huge concern. So you want to try and get your children to start out, when they're little, start them with mostly water, milk, and those are really the 2 best options. Another thing that parents probably don't realize is that the number of times that you're having these kinds of drinks, or any kind of sugar for that matter, really does have an effect on if they're going to give you cavities. So if you are having, a 60-ounce big gulp at one meal and you drink the whole thing down in one sitting, that's not as bad as drinking it multiple times throughout the day. So you really want to sit down and finish your whole drink at one time as opposed to sipping. So there you run into problems with things like sippy cups and juice boxes where a small child has it in their hand constantly and then is walking around and taking sips of it. That will help promote cavities more so than just drinking it at once.
I understand. Now, what would be some foods that parents can use to be able to promote better oral hygiene?
As far as foods go, you really just want to try and stay away from, again, sugary things, but in particular, sticky things. So things, a big one with parents that they don't realize is bad are fruit snacks or fruit by the foot, fruit leather, fruit roll-ups, because it says fruit, but it's really sugar and just stickiness. It's the equivalent of having gummy bears, basically. So you want to try and stay away from those kind of things and all the sticky, like I said, gummy bears and Swedish Fish and Tootsie Rolls and Starburst and all that good stuff. A much better alternative, because I know that parents need candy for whatever purpose kids are going to want some. You want to try and give them more chocolate candies because those don't stick on the teeth. And it's more of you chew it and just swallow it.
You're my kid's hero.
Yes.
Chocolate.
Yeah. Much better for the teeth.
Milk or dark?
Well, dark chocolate has better health benefits, so right. I would always recommend that. But any kind is better than the other alternatives. Lollipops are also terrible for 2 reasons. One, if you suck on a lollipop, you're essentially turning it into a juice or a sugary drink, a liquefied drink, exactly, which will cause you to get in between the teeth cavities. As opposed to if you chew on a lollipop, then it's sticky and it's sticking into the chewing surface of the teeth, and then you'll get the chewing surface cavities. What
would be the best foods? Crunchy foods like vegetables and things like that, carrots, celery, things like that?
Of course, fruits and vegetables are ideal. But kids can have things like pretzels and popcorn, and every kid's going to have some sort of junky food. But what's important is that you brush well, because one of the things that's going to cause cavities is the time that the food is sitting on the teeth. So the things that cause cavities would be, the food that's on the teeth, turning into sugar, the tooth structure itself, and as I said before, time. So if you're letting food sit on your teeth for 24 hours straight, that's going to increase your risk of getting cavities.
Dr. Rachel Hoffman, thank you so much for sharing your incisive views and great information about how people in East Brunswick can help take better care of themselves, especially their children and their oral hygiene. We really appreciate you spending the time with us today on the Wellness Spotlight.
Thank you so much, Ken. I hope I've given some good information to parents.
Definitely. This concludes another edition of the Advisory Health Council's Wellness Spotlight. I'd like to again thank Dr. Rachel Hoffman, pediatric dentist. I'm Dr. Ken Friedman, president of the Advisory Health Council. And remember, wellness works if you work it.